Hello, my name's AJ Diliberto, insurance agent here in Southern California. And today I just want to talk about 3 ways for you to lower your health insurance costs in 2018. 3 ways to lower your health insurance costs in 2018. So the first one is what I call basically lowering the benefits. So basically using a higher deductible plan and using one of our deductible busters. There's different plans out there, different supplements that you can buy that really are very cost effective. I've got a whole other video that I did on that, so I want to point you to my deductible busters video to go and explore the specific things that I use in that regard. Really no secrets here, just putting out good value for the consumer here in Southern California. Certainly if you want to contact me, that's fine. You just email me, ajd1000@gmail.com, and I am happy to chat with you. Or you can message me, private message me, make a note here on the YouTube, whatever it is. I'll find a way to get a hold of you. But regardless of all that, there really is value out there for you, other agents, whatever it is. But so anyway, thing number one, lower the premium, lower the benefits. And sometimes, to be honest with you, you can package up things in such a way, especially if you don't go to the doctors a lot, or maybe you're holistic and you really don't go to traditional doctors wherever possible. You don't do prescriptions wherever possible. So really your situation is a little more unique than the next person. So you can really afford to have a higher deductible plan as long as you've got some of these deductible busters, and you may be able to package that up and really have some tremendous savings. So number one is explore the deductible buster idea. Okay, number two is this was a little bit more complicated, but basically I'm gonna caveat it by saying you got to have an agent who understands the law. This thing is a big law. It is a tax law. It's obviously it's an insurance law. It's got a lot of different moving parts to it. So the understanding and your agent's understanding about the law is tremendous. So I was one of those guys who read it early on, followed it all the way through. I understand taxes as I'm as a lifelong planner and things like this. So anyway, and I have fun. Frankly, there's a certain art form to doing this. So you have to understand the law. There's a little bit of art, a little bit of creativity that sometimes goes along with it. What can we do? Understanding how we're estimating incomes into the future. Can we do that? How is that changing from year to year? And then working with the kids. How old are the kids? How much income do they make? Is it feasible to put them on Medi-Cal or not? Or do we use actually different plans? Do we put the kids on Blue Shield and put the adults on Oscar or something like that? So anyway, a lot of different ways you can carve up this situation. And so again, if you have the right agent who's willing to take the time and to work with you on your situation, you can find the best situation for you. And at least, regardless of what it costs, it's going to be a lot with most people anyway. But again, every year, there's home runs every year. People getting ridiculously good insurance for ridiculously not a lot of money. And why is that? Well, that's just because, again, just understanding the law and the creativities and the certain situations, we're able to do that from time to time. So anyway, that's one of the things. So number two is understand the law and how to take advantage of that and use a good agent for that. And then number three is I'm just going to call this one change plans. Just understand that maybe the plan you're on is expensive. So like this year, for instance, Blue Shield is expensive. That Blue Shield PPO plan is expensive. Now, some people want to, because they want the PPO, they're willing to pay it, and that's fine as long as you understand why you're paying it. You understand. I also have a video that explains HMOs, EPOs, and PPOs. And sometimes I find just by talking with people, they think a PPO is different. They think PPO means automatically, if it says PPO, it means I can go to any doctor and I've got the biggest network and all of these things, and it doesn't always mean that. So anyway, so you just got to understand what that is. But sometimes you can just switch from one plan to another. Like for instance, I've gone with Oscar for myself 2 years ago. Brought my family to Oscar last year. Oscar's not everywhere, and they're a smaller company that's just building, but they have a concept of great service, and they've done that. Everyone I've put on there is comments back, hey, how did you like Oscar last year? I loved them. They were great. Someone even had a really major health issue, and they said Oscar's been great through the whole thing. My wife is actually quoted as saying, I love Oscar. she says, she told me one day, she texted, I said, oh my God, I've never heard anyone say, I love HealthNet or I love Blue Shield, but she says, I love Oscar. So, and why is that? Well, it's because they have an app and they're very accessible. They've got a 24/7 doctor. So any time of day or night, you can actually get a doctor on the phone and have a conversation about your situation or your child's situations. It's powerful. It's a great situation. Their service is great. As an agent, I have direct access to certain people who can give us service. So if you've got an issue that I need to resolve, I'm not in some phone tree of trying to figure out what to do or sending an email. It doesn't get responded to for 4 or 5 days. It's a very responsive, service-oriented thing. So yes, I'm a fan of Oscar for sure. But all that said, and this year is the first year really they're tremendously less. So I'm happy to see that. But all that said, okay, you can switch to a HealthNet HMO or even Blue Shield's HMO. So Blue Shield has a PPO that's very expensive. They have an HMO, and some people, I don't want an HMO, and I get it. But at the same time, is it worth $300, $400, $500 more per month? What if your doctor's in the HMO? What if your hospital's in the HMO? And all these are 1-year decisions. Again, you're not locked in. You can have a situation this year, and then next year, that's a different landscape, different costs, different pricings. This year, Anthem's out of it. Last year, people chose Anthem thinking that they're going to pick this plan the rest of their life. Meanwhile, they're not even in business anymore. So we have to understand we're making 1-year decisions. Everything is a 1-year decision. So in this 1 year, right, can we, lower our premiums by going to an HMO instead of a PPO? Do we need to switch doctors? Frankly, I've switched doctors. I had my wife switch doctors. Was she happy that I switched doctors? No, she wasn't happy. But guess what? She found a new doctor. You know what she said? I love my doctor. So I know there's good doctors out there. Maybe you have to look around a little bit, and maybe it's a little bit of a hassle. You don't really want to do that. But again, if it's $50 a month, you don't change your doctor. But if you got a family and you've got to do a lot of things, and for whatever reason, your hospital and all these things are on another plan, and you can save hundreds of dollars, and maybe combination of the deductible busters, maybe an income situation. Just saying, just keep your options open, keep your mind open, and understand if you're paying more, just know why you're paying more, and it's okay if you want to pay more. By the way, I never tell people they're not allowed to pay more. I want to just make sure that everyone understands there are options and ways to lower coverage using all 3 of these things. And then it is what it is. I mean, at some point you've done everything you can do, and usually it's enough. I found that with most people, it is enough. So anyway, that's it. That's what's going on here. AJ Diliberto, AJD1000 at Gmail if you want to get a hold of me, or private message me, text me, whatever it is. Well, you can't text me. I didn't give you my phone number. Got you there. Anyway, AJ signing out here, California insurance agent. Thank you.